Please begin. Dr. Arpita, Honorable Vice Chancellor has joined.
Yes, ma'am.
Please.
I'll just do A very good afternoon to one and all. Myself, Dr. Arpita Brigwanshi, Associate Professor, Department of Pediatrics, KGMU. I would be your host for today's program. The galaxy of intellectuals, our excellence, invited chief guests, teachers, dear students, and my dear friends. We all have gathered here today for the inaugural ceremony of Online Recent Advances in Pediatrics, a webinar week organized by the Department of Pediatrics under the able guidance of Professor Head Dr. Shelley LSC. We have amidst us our Vice Chancellor, Sir, Lieutenant General Bipin Puri, Sir, who has always been our motivation to take our academics to newer heights. We now start with today's proceedings by seeking the blessings of Goddess of Knowledge with the Saraswati Vandana performed by our residents in the Department of Pediatrics.
May I request everyone to please. Arpita, please mute yourself. This one not.
I took up an offer with 70% hike and an exciting role.
आद्यां जगद्व्यापिनीं हस्ते स्फाटिकमालिकां विदधतीं पद्मासने संस्थितां वन्दे तां परमेश्वरीं भगवतीं बुद्धिप्रदां शारदाम्
That was such a wonderful Saraswati Vandana. I would now like to request Professor Shelivasti ma'am to welcome and give a brief about the genesis of this webinar.
Thank you very much, Dr. Arpita. Honorable Vice Chancellor, sir, faculty of our department and of other departments in the state of Uttar Pradesh and rest of the country, resident doctors of Uttar Pradesh and of our own department. We have several alumni who have joined us. I welcome all of you to this webinar. May I request all of you to please silence yourself. Dr. Sunil, please silence your phone. Please silence your mobile phone, Dr. Sunil. Hello, can you hear me? Please silence your mobile phone, all of you. So as we come out of the second wave of COVID, and as we did last year, we have organized a recent advances webinar by our own faculty and a couple of senior residents. The aim of this webinar is to come back on track with the academics, which is what we are here for, COVID and beyond COVID. In the present day and age, remaining update is one of the basic necessities of all of us clinicians. Therefore, continuing medical education is one method which improves our knowledge constantly and equips us better to take care of the patients, and it boosts our confidence. Every day for 6 days, we will have a CME, which is of 2 hours. And this is in sync with the promotion of subspecialties which are being practiced in our department. Like on the day one, we are having infection. We are having on day one intensive care. Then we are having neonatology, infection, neurology, hemato-oncology, and pediatric pulmonology. All these lectures that we are going to have, our Honorable Vice Chancellor has always been there to help us, to support us, to motivate us. And with his motivation and help, we could possibly take this beyond our own institution to other colleges which are not only in Uttar Pradesh, not only affiliated to us, but also to rest of the country. So this is the genesis. And again, I would say that I'm very thankful to our institution, our own faculty who have prepared this lecture, and for all of you who have joined today. And hopefully you will be joining us for the next days that are to come. Again, may I request all of you with folded hands to please mute yourself. Please mute yourself. Just click on the mute button and mute yourself. I will be really very, very obliged. Again, Dr. Sunil, your iPhone is unmuted. Please mute yourself. Over to Dr. Arpita, please, for the next.
So I will begin with sharing the video of our department. I'm sure this video must have brought so many fond memories in all of us. With that, I request Professor Shelly Vasti ma'am to introduce our chief guest, Vice Chancellor of KGMU, Lieutenant General Bipin Puri sir.
Thank you very much, Dr. Arpita. This was a brief glimpse of our department, which is spread over such a wide area. It gives me immense pride and privilege to introduce our Honorable Vice Chancellor, Lieutenant General Bipin Puri, who took over as the Vice Chancellor of King George Medical University on 10th of August 2020. It's been a year, and this has been the most happening year of our institution, where we not only have fought COVID, but Sir has marched us into new areas where the institution has excelled in many, many fields. General Puri is an alumnus of Armed Forces College, Pune. He was commissioned in the Armed Forces on 30th March 1979. He did his post-graduation in general surgery in 1985, MCH pediatric surgery from PGI Chandigarh in 1993, fellowship in pediatric urology at Birmingham Children's Hospital in 1997. Sir is a renowned pediatric surgeon, and he has pioneered many techniques, the NUSS procedure for pectus excavatum deformity in India, to name a few. For his contribution towards the field of pediatric surgery, he was honored with Ethicon Traveling Fellowship Award for the year 2005 by the Indian Association of Pediatric Surgeons. For his excellence in medical profession, the General Officer has been awarded Double Helical National Health Award 2017 by the Indian Medical Association. Sir has been, besides his position, he had the highest position in the Army. He was the Director General Medical Services Navy, Director General Medical Services Army, and for his distinguished service, he was appointed as the President's Honorary Surgeon on 1st June 2016. He was conferred with Vishisht Seva Medal on 26 January 2017. Sir, it is our honor to have you as the Vice Chancellor of King George Medical University, and we are humbled that today you are here with us for the inaugural session of the week-long webinar. This is an event to spread academics among pediatricians. Sir, thank you very much for being here with us. Over to Sir for his blessings for the occasion. Sir.
Am I audible?
Yes, sir.
So Professor Shelly Avasti, faculty from the Department of Pediatrics at KGMU, pediatricians, residents in Uttar Pradesh who have joined us, pediatric Georgian alumni nationally and internationally, delegates, residents, ladies and gentlemen. It gives me great pleasure to be associated with this inaugural function for this Pediatric CME 2021. And I wish at the outset, I wish this CME bring success. Well, friends, ladies and gentlemen, you'll all agree with me that the last year and a half, we in this college, in this university, have been seized by the pandemic. And therefore, academics, for reasons you would all understand, has taken actually a back seat, as most of us, including the Department of Pediatrics, have been neck deep in the COVID management protocols and involved in different capacities. I would like at this point of time to congratulate the Department of Pediatrics of this college, this university, for rising to the occasion and contributing selflessly in this huge human disaster, unparalleled in human history. Well, friends, we believe that COVID-19 pandemic has actually significantly impacted the residency program, including that program, education and training, and profoundly changed our daily practices. Also, the fact that the academics was pushed to the backstage, compromising on non-COVID knowledge has been a setback. It has been a problem, an issue which we are seized with. But I'm happy to see that the Department of Pediatrics, once again, is taking the lead for organizing this seminar and putting up a sweet sequence of very contemporary topics which are not only relevant to the residents, but are also to the practicing pediatricians for updating themselves with the newer paradigms in critical pediatric care. As I go through this 6-day webinar schedule, I see that these they include most of the pediatric subspecialties which are being practiced in this medical university. So I congratulate Professor Shelly Avasti and her team for putting this up together, and especially the curriculum of this, I think, is of immense importance to one and all. Well, let me also say this, that the department has contributed immensely during the first and the second COVID wave with active participation from the residents, faculty, and staff. And I congratulate each and every one of you for doing a bit, and because whatever you did contributed hugely to the overall performance of the university. I also have been informed that the department has been instrumental both at the state as well as at the national level in the preparation of the third wave, the third COVID wave, where it is, at least it is predicted, the children will be at risk. Now, having said that, I do only hope that the pandemic will be kind to the children as it has been till now in the first and second wave. Friends, it is heartening to note that the Department of Pediatrics its own resource center for the people of the state and the region to prepare them for the third wave. So multiple templates, classes, interactions have been pioneered by the Department of Pediatrics at KGMU to take across ICU care, pediatric ICU care across the state in multiple fora. And I'm so very proud, and Professor Shelly Avasti and her team have been doing an exemplary job. The department has also been doing excellent work in patient care, teaching and research since 1956, and it's now a legacy of professionalism, which I see in day-to-day life as I walk through and a pleasure to see the Department of Pediatrics rolling out whatever they do, whether it's patient care, medical research, or teaching programs. So my compliments to the Department of Pediatrics. I have to make a special mention to the very dynamic head of department, Professor Shelly Avasti, who's also at this point in time the Dean Research of the Medical University, for her exemplary leadership skills and navigating the department during troubled times. Friends, the COVID times has been not only for the country, for the state, for Lucknow, for the district, but also for the college and the university. We've gone through thick and thin, and during these tough times, Professor Shelly Avasti has done an exceptional job. And not only was it in terms of patient care, as far as medical education, which she continued despite the COVID setting, and also continued to be the Dean of Medical Research and carrying on a phenomenal amount of work as far as research, medical research in this university is concerned. So once again, proud of my Dean Research at Sherry University and her team. Each one of you, let me say this, each one of you under her umbrage and under her umbrella have done a phenomenal job. I hope this webinar consisting of the lecture series will be an academic feast for the residents and delegates from the region and in a way from all over the world. So thank you once again and Jai Hind.
Thank you very much, sir, for your motivating words and for your, I'm really humble, sir. Thank you very much, sir.
Thank you so much, sir, for your words of encouragement. You, as our head of institution, have always been a constant source of inspiration to always excel. I would now request all of you to rise for the national anthem.
मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत